Hi everyone, welcome to another Clinimetrix 3 explainer. Today we're going to have a look at the new clinical dashboard. So if you've seen any of our previous videos, you will note that we've done a lot of work in combining the tools to make them faster to get to and easier to use. In this case, the new clinical dashboard puts all of the clinical reporting tools in the one sheet and allows you to move around very quickly by simply just selecting on the tabs rather than having to dive from sheet to sheet to sheet. So that actually makes things much faster to just get some really quick information out and drill down between sheets and detail if you so wish. We won't be doing that today. I'm just going to cover over what is actually in each of the sheets and explain how each of the tools works. We'll get into more detail later on, and we'll also present in more detail some demonstrations of our new patient analyzer tool, which is extremely powerful and possibly saves you a lot more time than doing some of the drilling in through the clinical dashboard. It's a good chart though, or a good report though, to use for kind of an overview of your business and how things are operating, and it gives you opportunities to dive in and see some of the things that you won't actually be able to get through multi-layered comorbidity mapping or those kinds of things. So same rules apply for chronic disease as it does with EPC. On the chronic disease sheet in clinical dashboard, this is down here, this first chart is all of the patients over all time in this practice who have a diagnosis as documented by the practitioner of any of these chronic disease items. Once you select one, it will give you a period to work within, which will be the last time that the patient attended. In this case, it is all time. So, and then we just, it's down here. And then we simply click on the period we're looking for and then go to patients. It will export the list of patients who are due for a 721, 723, etc., who have attended in 2024. I won't do that here, we'll do that in another demonstration. So that's really what this tool is all about, giving you the ability to quickly move into all the patient opportunities that you are looking for. We'll talk about Proto in another session because there are some issues with respect to Proto mapping that we'll explain in detail in another video. Moving on, we have tests requested. So this is all of the tests that your practice has sent to pathology as documented from your doctors. So this is the charts by time and by test type, and doctor name and patient. So you can drill into any one of these and start moving around and see, well, okay, what do I want to know? How do I want to drill into what tests have been requested? And from here, you may actually then want to consider what's been requested and what's actually had a result come back in. We'll show you that in another demo, but in this instance, you can to explain, you can start with, I want to see all the patients who've had a HbA1c request, and then from there, I can move into what time did that occur, name of the patient, what doctor issued it, and we can then select that list and move on to how many of those have actually come back with a response. As with all new Clinimetrix, there is a table with a list of patient names, details, what all the requests are, as you can see in the prescribed test, and a pivot table that allows you to move some of the detail around as required. So, which doctors have requested the test, in this case, we're still looking at HbA1c, and then you can see time, dates, patient details, and those sorts of things. Test results is exactly as you would expect it to be. What test results have we seen over any period of time as set in the period controls? Right now, this is for all time in this practice. We only have 2 years of demo data in here, so it's not a huge data set, but if we're just looking to limit that to the last financial year, I can see this is what's been going on in my practice in terms of test results inbound for the periods and some of the results against that and the doctor name. So if I'm looking for EGFR, I might just select that, and that gives me then the ability to drill in. I can have a quick scan through that table result and note that a lot of these patients have a result that would be considered concerning, and you can select that here by just dragging this way, or we can go into the table or the pivot table and select it manually. So that gives us some ability to dive in. We can also do that in the analyzer tool as well. In the table, I'm still got eGFR selected, so I might actually say I want something less than 60 as a demonstration, and now I can select that, and we have a list of 442 patients who have an eGFR that is less than 60 recorded since July 1 of this year. Moving to the pivot table, we have the same kind of controls that we have seen previously with all the pivot tables, and you can then select any of those kind of items that you want and move the data around as you would prefer to make the results suit the way that you want to report them or export them, as the case may be. So that's test results. It's very similar to what we've had in the past, and you can dive in, show me all the patients that have this condition with these limitations, and then move into the next condition and the next condition. But now with our new analyzer, you probably won't be using it in the same way, but it will give you fast ways of just getting a singular data point, or in this particular case, looking at the nature of the results in your practice for a particular condition and result. Moving on from test results, observations. So again, we're going to be looking at observations for this financial year, and like the test results, it's by the type of observation, so BP, pulse, weight, height, waist, K10, etc., all available in here. So we'll start with systolic as a simple demonstration, and now we can see how many systolic tests have been done so far in this fiscal year, who did them down the bottom, and a chart of the results on the lower right hand corner. And you can see that there's a lot of 120 kind of normalized results you'd be expecting here, and then substantial amount that are lower than higher, and that gives you an indication of the trending of those results in your practice. And you can export that data, you can search through that data as we've done with all of the other things. So you've got a table result. We're still looking at systolic, so I may consider that I want to look for people who have high blood pressure, so we're looking for greater than 140. That now gives me a list of 1,240 patients in the practice who've had a measured result of systolic greater than 140 since July 1 this year. So quite a handy tool for getting into that kind of quick output data. Again, we have the pivot table, so you can play around with the structure of your data as you want to allow you to build the models that you see fit. So you can just move that data around any way you like it to be structured, so you can export it for any purpose. So that's the observation tool. We also now have a script tool. In this case, we've added in some more functionality for scripting, in that now we can also dive into script strength. So if we're looking at a particular type of medication, we can do it by script name, we can do it by drug class, do it by period of time, and also the patient name. But as we drill in, again, through the patient cohort analysis and the tables, the pivot tables, we can get other detail available to us. So we might just want to look at a simple one like Mobic. So see what's actually being prescribed for Mobic over the last few months in this practice. There are a couple of types of Mobic here, as in the drug class classifications have been set up, although it is the same result. These are the patients that have had that prescribed to them, and this is the volume of Mobic prescribed. But going to the table, we get more data. Now we have script strength available to us, and you can also look at the quantity prescribed by practitioner, by patient, as the case may be. So quick way of finding the data of what's been prescribed. Mobic's probably not the best example of something you'd be concerned about, but nonetheless, it gives you a good indication of the nature of the data that can be extracted from Clinimetrix. And again, we've got the pivot table, so you can actually go in here and move things around to see who has been prescribing, which patients have got it, and the strength and dates and the usual kind of things that we've seen in the table, but you can manipulate the data as you want. One thing I had failed to mention in the previous sheets here is that you can actually just click go to patients and it will export the current list of patients, or take you to the export page for current patients in the database. Moving on, we are going to just look at patient history. This is data extracted from the practice management software from two specific fields. It is the diagnosis field and the reason for visit field. The reason we do that is because in the main, reason for visit very often includes the diagnosis, and diagnosis doesn't always include diagnosis. If they are the same, then obviously we take the diagnosis field. A couple of things have been added here, so you now can actually just dive into the data through the charts as we would normally expect, in patient names or the doctor. We have the table as well to allow us to dive into the data and sort by. We've also now added a new feature of when the diagnosis occurred. So if you're looking for a specific diagnosis, I want to look for diabetics who were diagnosed as diabetics in the last 12 months, then you can do that by now selecting the diagnosis date range. It's a new feature added that allows us to kind of get a little bit more granular with the detail that we have in Clinimetrix. Pivot table, same story. You've seen this lots already, so we can now look at your QS usual doctor and the number of conditions and condition counts that have occurred by doctor, and you can move that data around as you wish. Our correspondence reporting remains the same. We're in the pivot table. I'll go to the chart. This allows you to drill in and find all of the in and outbound correspondence that has occurred in your practice. This is a feature we've had for many years, one that some of our competitors are looking to catch up to now, but you can follow up on any referral that's been made to any type of contact category. So we can look at cardiology. We're actually doing internal research the other day on endocrinology referrals just to see how many patients had actually been sent to an endocrinologist over the last 12 months. In this case, we can see in this demo practice, there's 166 patients who've been sent to an endocrinologist. We can see this in a table form as well. And of course, you could have sorted in the table form, and you get the ingoing and outgoing correspondence mapping. In this case, there's no inbound correspondence. Again, it's the demo deck, so sometimes we don't have that data. And as usual, pivot table controls as well, so we can see by the pivot table who's been sending those outbound correspondence and the quantity to the endocrinologist. And if we want, we can also do it by the doctor name. So we can actually get that data really quick. We see in this particular instance, this doctor in this demo practice gets the majority of the endocrinology referrals. So quite a nice little tool for trying to follow up on failed referral attendances if you're looking to do that. Immunisation reporting is consistent and repeated from our previous versions. You can drill in very quickly and see who has actually had an immunisation and when that has occurred. And you can sort by batch numbers much faster than doing it in the practice management software. You simply type in the batch number and it will give you all the results. You can also do it by the vaccine name. It is a very powerful tool for chasing immunisation data. Lastly, in the clinical dashboard, and I realise this has taken a bit of a while as an intro and demo tool presentation, is our PIP data. So what we are looking at now is mapping the QI PIP data in your practice, and you've got the results in a table. So actually in this practice, all of the chart in all of the results have improved period on period, and here on the right hand side you can also see the table. There is a brand new PIP reporting sheet as well, but we'll cover that off in another video. I hope you found this useful. If you've got any questions, would like to see further detail, please let us know.